Hi, Dr. Williams. Thanks for watching our YouTube videos. This is a fireside chat on fillers versus fat. How do I know what is my best option, and when do I do what? I get that question all the time. So let's just talk a lot about the aging process. We used to think that aging really had to do with just tissue dropping, and for those patients we do a lift. But as we get into our early 30s and 40s, we really start to see some volume loss in and around the mouth, the mid-face, temples, forehead for that matter. So we do get volume loss. It's the concept, and if you take a look at pictures of people as they've gotten 30s and 40s and 50s, you can definitely see that volume loss. So to us now, rejuvenating with volume in conjunction with the lift is something we do on almost every patient. Okay, so let's talk about fillers versus fat grafting. The way I look at it is fat grafting addresses more of the volume, the deflation itself. Fillers work for specific areas like forehead furrows, marionette lines, thin lips, wrinkled lips, and even sometimes in the mid-face where people start to lose, but it's typically we use fillers for very, very specific areas. In fact, patients who undergo a surgical procedure and have fat grafting often will come in and still get a little bit of a filler in the marionette lines. So what are the advantages and disadvantages of fillers versus fat grafting? Well, let's just talk about fat grafting. The advantage of fat grafting is when I'm doing fat grafting on a patient, I can harvest a lot of fat. We all have a little bit to give up, right? So if you take and I harvest 60 or 70 cc's or vials of fat, I can address the mid-face, the hollowness of the eyes, the temples, the area around the mouth, all of those areas. So that is an advantage of fat grafting. Fat grafting also has a lot more longevity. We lose a little bit each year, but unlike the fillers, you typically fillers you lose in a year or two. So the fillers go away a little more quickly. Fat grafting has some advantages in that I can do larger volumes, but has some disadvantages as well, because one of the disadvantages is fat grafting, as much as we love it as a procedure and we see changes in the skin that go along with rejuvenation, it's not 100% predictable. There can be a little asymmetries. It works in everyone, but it isn't perfect in everyone. To me, there's really no downside to doing it when it's done well, because it really helps a good lift look great. So there's some of the advantages of fat grafting. I can do a lot more of it. It's more economical long term. What's the disadvantage? You definitely get a little bit more bruising, a little bit more recovery, a little bit more swelling with fat grafting. What's the advantage to fillers? When someone has a cocktail party or coming into the holidays or birthday or a reunion or wedding, fillers are great. This makes me crazy, this makes me crazy, my lips, can you get them a little thicker? That's where the fillers work. So as we start to transition into more and more volume loss and the fillers no longer work, that's when we start thinking about doing a more significant fat grafting or volumizing procedure. I hope that answers your questions. When do I do fat grafting? When do I do fillers? Certainly you can check this out on our website. There are other YouTube videos. Okay, so thanks so much for watching, and I hope you found this informative. Again, check us out on YouTube, /Williams Center, WilliamsSurgery.com, and follow us on Facebook.